Hi everyone, welcome back to Behind the Scenes in Health with Dr. Ron. And today we'll be delving into the exciting world of clinical informatics. And if this is something you're interested in, so just grab your popcorn and your water, sit back, and let's get into the conversation, right? So, what's clinical informatics? What is it all about? How do I get there? What is the career progression? How much am I going to earn? These are some of the things I'll be talking about in this video. So you might just want to stick around to the end of this video to explore and understand these insights. So at its core, clinical informatics is the intersection of healthcare, information technology, and data science, and basically revolves around the effective use of information technology to improve, to enhance healthcare delivery, optimize patient outcomes, and also streamline clinical processes. So that's like a high level summary of what clinical informatics is about. And some people will now ask, so what does a clinical informaticist do? So a clinical informaticist does a lot of things. So that's why you come across the role, the word multifaceted role. But basically, they serve as a bridge between the healthcare professionals and technology systems. You ensure that EHR systems, that's electronic health record systems, or health information systems in generally, are integrated seamlessly into the existing clinical workflows of whatever organization they're working with or working for. So if it's a hospital, if it's maybe at a primary care level or secondary or tertiary healthcare, so you ensure that those systems work with the clinical processes. You don't want to disrupt them and all of that. And the ultimate goal is to improve patient care, really, to make that experience better for them. So what do I need to get into clinical informatics or even become a clinical informaticist, right? So just to put this disclaimer, that role is, how will I put it now? You need a degree in healthcare, basically. Let me just make it as simple as that. You need a degree in healthcare. So it could be as a medical doctor, as a nursing personnel, and sometimes you also need additional training in health informatics or a related field. So like myself, who is talking to you, I'm a medical doctor, and I still went ahead to have a postgraduate degree in health informatics, right? So that was why, and so I could decide to delve into clinical informatics, right? But I'm still here. I won't tell you guys what I'm doing at the moment. So you start with your basic degree in healthcare medicine or nursing, then go for an extra degree in health informatics or a related discipline. Now, sometimes you might not want to go for an extra degree, postgraduate degree or something, especially maybe if funding is a challenge, which I've heard a lot of people talk about, because you're going to spend quite a lot of money trying to get an extra degree. There are certifications you can pursue, like the Certified Professional in Health Informatics, which gives you an extra layer or enhances your credentials, really. And once you have those qualifications, then in terms of skill sets, we think we're talking about things like communication skills, we're talking about analytical skills, we're talking about problem solving, we're thinking about people who understand the healthcare process. So that's why this role is particularly suited for persons who work in the healthcare space. You understand how healthcare moves, clinical systems, processes, and all of that. Then you talk about effective communication, you talk about teamwork, you talk about collaboration, you talk about very strong interpersonal skills, ability to liaise with different stakeholders. So these are key skills that you need. There's a video I made about soft skills that you need to excel in health tech, so you probably want to look for that video on my channel. I'll probably drop the link in the description for you to find it. And a proficiency or interest in information technology and data analysis, though those are usually the skill sets required for you to get in. So you might just want to take a pause now, look at yourself to see if you actually possess some of these skill sets that I've just mentioned. Then if you do, then clinical informatics might be calling you. So in terms of career progression, for you to move smoothly in this career, you need to gain hands-on experience in healthcare settings. That's why in one of my videos I said, yes, you finish medicine or you finish nursing, you don't just jump into what you call it now, maybe a postgraduate degree or something. You should work as a healthcare professional at least 1 or 2 years to really get the hands-on experience how healthcare works, how systems operates. Then you'll be able to make valuable input to wherever you're working. I'm not saying if you don't do all of this, you won't be successful, but I mean, it makes your life better, really. So you gain hands-on experience in healthcare setting, then you can specialize in specific areas. Like myself, I tend to narrow down or niche down to electronic medical record systems. So implementation, or you look at data analytics. And as you get to accumulate more experience, then you start looking at roles like the clinical informatics manager, things like director of health informatics, or even becoming a chief medical information officer. I made a video on how to become a chief medical information officer a couple of days ago, so you might also want to look for that video and have a look at it. So it's worth also mentioning that for you to get into these top roles like the chief medical information officer roles, you also need some leadership experience. So that's where some certifications, leadership certifications or courses come in. So you probably want to put that at the back of your mind. If you work in the UK, there are a lot of free NHS leadership courses that you can, take benefit of. Again, I have video on that, so you want to look for that and watch it. Now, in terms of salary expectations, again, salary basically varies on location, varies on experience, and the specific organization where you work for also affects it. For example, what Google might be paying you if you work for Google wouldn't be the same if it's a normal hospital or hospital that is paying you, really. So in the US, you typically be expecting a salary range about 90 to 130,000 US dollars annually. In the UK, you'll probably be looking at salary of 40,000 to about 90,000 pounds annually on the average. Sometimes a little bit stretching into 100k salary brackets, which is not really bad, honestly, right? So if you're interested in building a career in clinical informatics, you need to look for opportunities to work with EHR systems. You need to look for opportunities to work with data analytics projects or health information management. Then you need to stay updated with latest trends in the healthcare technology, which I try to do. It's quite difficult, but it's doable. So you set alerts in different journals, you tend to attend conferences, you join communities on Facebook and LinkedIn, health informatics or whatever it is you're interested in. So that gives you, updated on what's happening. Then you can also consider pursuing advanced degrees and certifications, just like I did. So that means I'm on my way to becoming a chief medical information officer, right? So just to conclude, clinical informatics is very exciting. It's dynamic, and because it sits in the middle of, information technology and healthcare delivery. So if you're very passionate about improving patient care through innovative solution, then this could be the perfect career path for you. That's clinical informatics. So before you go, subscribe to the channel to always get information like this, which you don't get anywhere. Thank you for joining us today, and I wish you the best in your journey into clinical informatics. I'll see you in the next video. Bye for now.